Okay, let's get started. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the February 18th Boulder County Public Health Update designed for cross-industry. Lane will be going through the normal information, but if you have questions, please put them in the Q&A and I'll ask them on your behalf. If you raise your hand, I'm not able to actually unmute you at this time. So we will get started and hand it over to Lane.
Thanks, Corinne. Thanks everyone for joining us. I'm gonna give you our update on where our metrics and data is. We'll talk a little bit about the dial, at least one little change that I'll mention that may impact some of you on the call. Don't expect any changes immediately with the public health orders and dial, but there has, as we've talked about in past sessions, there is some projection in the next month or two that the state may change that. That'll likely be very linked to the success and the amount of folks that have been vaccinated. And then hopefully we'll have plenty of time for any questions that you have. So we are still continuing to be in the yellow dial status. So we're comfortably in that status, not quite ready to launch into blue, at least for one of our metrics, but also not necessarily risking moving backwards. So for that purpose, feels fairly stable right now. Our 1 week cumulative incidence rate, that's the one that's keeping us right now in yellow. The other ones are a little more favorable, but that 117.4 per 100,000 of our weekly incidence rate. So again, pretty comfortably in the yellow. As you'll see, really the whole metro area is doing well and stabilizing there. Our positivity rates continue to be very, very favorable, very similar to last week. I think it was 3.1% last week, 3.2% this week, but within the blue. So again, one of the metrics in blue, which is one check down that we need to eventually move to blue. And then the third metric is that hospitalization status. And this one's kind of fluctuated a little bit. Again, even though it's kind of showing orange, it really bounces around from blue, yellow to orange. So it's the least sort of stable one, but again, overall, the hospitals are not nearing capacity, which is good. And as every week we get further into the vaccination phases, and so that will continue to be less and less of a risk point. This is the trend that you've seen for many months now if you've been joining us, and again, continues to be favorable with that decline in our overall average number of new cases that we're seeing. Definitely have survived that huge wave and spike that we saw near the end of last year, and even the spike that we saw from likely the Christmas holiday timeframe. So right now we're seeing about a 55 case per day average on that rolling average, what we're seeing when we look across that. So that's good. That's been a decrease from where we were last week, which was about 64 cases per day. So again, that trend is coming down, and that's what we really want to see. So we want to continue to see those overall cases. As you can see, back when things were really good for us, when we had some, again, more flexibility in the summer, we're quite a ways above where that was. But with the new dial changes, it's still going to hopefully get us back to where there's a lot more flexibility within the community. This is kind of our positivity, really highlighting something that we've been seeing and have continued to see throughout the pandemic, is that disparity within the Hispanic Latinx community. So they still are overrepresented in the number of cases and hospitalizations as well as deaths. So our team that is dedicated to that is actively working on improving vaccination rates as well as outreach to those communities to continue to focus on that. This is something that we really want to see turned around. So this is counts, again, of people who've received a single vaccine and those who've received a full course, just to distinguish for those that these people, once they receive a second dose, they're moved into this category. So these are each independent numbers of groups, and then this totals hopefully adds up to the total number of people who've had at least one, if not two vaccines. So again, continuing to move down and move through the phases. I think we've got almost all of our emergency responders vaccinated. I do have good news that as far as Boulder County, we have actually surpassed the 70% for our 70+ population. I think I have a slide here. This is actually as of Sunday. So as of today, we have gone past that 70%. So that's great news. Now we just need our peers to catch up, which they are very close. So as a state, we still believe that by the end of this month, the state will achieve that goal, which would then open up that opportunity for businesses to operate in the blue as we're in yellow. But again, you can see overall where we're at with vaccinations by age group. Just some key takeaways to share. Again, we're still trending down, which is great. And that is, again, consistent across the metro area, which is also important. We know that the impacts from our neighboring counties are important. We have people living in one county, working in another county, so school districts cross county. So it's really important that we see those trends regionally, not just within our county. We are seeing good trends overall in our various age groups. So again, we aren't seeing too much significant problems across overall age groups. There was again an increase. It's again kind of going back and forth a little bit, but we did see an increase in the 18 to 22-year-olds. So we are going to keep an eye on that. I guess that was a source of one of our outbreaks in the fall, and a lot of work with CU and the city of Boulder to continue to make sure we address that. Again, we continue to highlight the disparities in our Latinx community, continue to try to focus on the 70 plus, making sure we're getting good representation of Hispanic Latinx community that are vaccinated in that group, as well as the other groups that are available. And then certainly ongoing efforts to address the overall disparity with hospitalization and deaths amongst those groups. Deaths among Boulder County residents. Let's see, let me get to that part. So our most recent death was on February 10th, which brought us to 242 deaths in Boulder County since the pandemic has started. Our vaccination numbers I shared with you, we're over about that 41,000. So that's very positive. And again, hopefully seeing more consistent amount of doses coming into the county. Again, that has been our Achilles heel, is not getting enough vaccine. And that's been a trend really across the country, not just for Boulder County and the state. We've shared our positivity and testing numbers. So those continue to trend favorably, which is what we want to continue to see. And something that is a measure of what's kind of happening within areas based on sort of mobility data is looking at overall social distancing, how many people are staying around the same percent or moving up or down in social distancing. Statewide is seeing about 38%, whereas in Boulder County, 55%. So we're doing a little bit better job, I think, within our county than what we're seeing in the state. So that's also very good and favorable and appreciative of our community. Just again, provide that link for folks to get to the dial. The only, I think, change, and again, I don't know how many folks on the call this will impact, but there is going to be a reduction in the distance requirement between a performer, or at least we believe it'll also apply to performers. Right now it's between athletics and people that are there viewing it. So it was a 25-foot distance requirement. The state has reduced that to 12. And we believe that'll also apply to performers and audiences so that they will also be able to be 12 feet instead of 25 feet. And so I know for some businesses that 25 feet is really difficult to achieve, whereas 12 is a lot more realistic for folks. So we'll keep you posted on all of that, but that's one change they made related to athletics and performers, or at least we believe it all applied to performers. This was just that ongoing slide, just for those who haven't joined us in the last few weeks, just to see how things have changed within the Diametric. I'm not going to spend a lot of time on this, but overall, we've seen a change again from 14-day measurements to 7-day measurements. And then the individual phases have seen a flexibility where now it's easier for us to move into those more favorable levels of the dial. This is something we shared last week, just in case folks weren't on that, just that update of where the level yellow is for our businesses. And the easiest generality is pretty much all sectors are allowed to be at 50% capacity or up to 50 people. There are some nuances across certain sectors where you can get a little bit higher numbers based on seated events and where your space for very large events that can get a little bit more. And actually this, I think, is bumped up even a little more from Friday's change. So on what those are. FiveStar program continues to be active. I know there's been a number of audits already been happening. So I think there's a lot of businesses that are excited for the state to hit that 70 percentile. And I'll let Corinne give some of the other updates of kind of what's been happening with the FiveStar program.
Sure. So currently on the website, we have approximately 29 businesses that have been 5-star certified since the launch of the program. So they've gone through all parts of the process and are certified. The website for the program does list those businesses. So we will continue to list the 5-star certified businesses, and the compliance process is through that main website. If you did apply for 5-star and you haven't heard anything back, that's probably because the email went into spam. As soon as you apply, you should get instruction emails. So let me know. Email me immediately. I know one of the questions was like, how long? In some cases, people were able to fix the things that were an error, like they didn't have their EPA, they didn't have their cleaning supplies uploaded, or they didn't have their HVAC in. So we were able to get that taken care of, get them their audit ready, and then get those inspections scheduled. So I know one of the questions was how long. Email me. We'll make sure you get that information so that we can move you along in the application. Applications are still open. We have plenty of inspectors right now. So right now is a good time to apply. It is only a $100 one-time application fee throughout Boulder County. It is across many industries. We have everything from manufacturers to restaurants who are applying. Some cases it's for that public and employee benefit to show that you are following the public health orders. In some cases, it is to increase capacity, or when we hit that 70% of the 70-plus-year-olds being vaccinated in the state, being able to operate in that blue, which may not be increased capacity, but may be a later last call. So we are sending reports to each of the municipalities every week, as well as the state, on those businesses that are not only applying, but also certified. So if you have any questions, please do not hesitate. Don't wait. If you haven't heard back from anybody, just email me and we'll get you through the process. Now, like I said, now is a good time. We had a big rush at the beginning. We have kind of a lull for those businesses that are waiting for us to hit that 70%. I don't want us to then have a big rush at that point too, and then it take a while to get the inspection process in place. So if you're thinking about doing it, we have inspectors available right now to go out. We've trained something like, I think it's 14 or 16 inspectors in the area, and there are some that are doing it as a full-time job. So again, send me questions, and thank you for everybody that's participated.
Thanks, Corinne. We've highlighted this for a long time now too, but just still want to mention it again, that exposure notification system. This is an additional tool that assists public health in identifying cases and hopefully avoiding widespread disease by helping notify folks that they potentially were exposed to a positive case. So that's a pretty easy app to add. I've added it myself and very fortunate to not have any alerts. So happy that that is still in the case. You've already found your way to our time. So this is our set time, Thursdays at 1 for our general updates. Should we have any major changes, we have reserved that time on Friday. We don't have any right now and don't have any forecasted, at least right now. So we will not have a Friday session. And then our Spanish language session should be released today. That's pre-recorded, and all those can be found on the Chamber's website. All those links to pre-recorded as well as this one will be posted once we're finished. And I think we've got plenty of time to answer questions. This is how you can reach us, and through the call center as well as our business team.
And I appreciate the person who reached out on here about their 5-star application immediately emailing me. So I will get you submitted into the H2 system. All right, so that question's taken care of. Let's go into some pool questions. You heard about these beforehand because they were emailed to us, but they were also submitted via Q&A. Are private swimming pools or any swimming pools allowed to offer youth swim lessons that are instructor led, so instructor holding the child in the pool? This particular person said they're seeing some of the private pools doing that in their lessons and wondering if that's part of the order, or if there will ever be a part of the dial that will allow this.
Yeah, that wouldn't be compliant with the order. Only, I guess, the exception would be family members, can have that close contact without a mask outdoor, but otherwise it would not be allowed for under the order. And in any of the dial phases, it doesn't remove those masking or social distancing requirements. So, the one exception I think is another question we have is maybe a life safety training for lifeguards where they may have to have some interaction. That's more of a critical business and critical function rather than just routine lessons for swimming. So again, it would need, if it's that young of a child, it probably would need to have a parent if they need someone in the water with them.
Okay.
Also,
So, and again, the dial's not really going to change that particular piece. The dial really just changes capacities, and in some cases, last call, those types of things, but not necessarily the social distancing, the masking, and some of the requirements of the public health order, correct?
Yeah, our current dial does not. So we do know the state has forecasted a change here in the next couple months, and then potentially a final change sometime in the summer. So we don't know if those will have those kind of components in them or not. But as of right now, we don't see that in the current dial in any of the phases. So even if we made it to blue or even green, it doesn't remove social distancing and masking. It really just, as Corinne said, changes capacity allowances for different activities and services.
And so you answered the lifeguard questions. The question was specifically around lifeguard training and how, as we approach the summer, do we train those skills that require us to do some of those life-saving skills. And you answered that, but are there any special precautions they need to take or anything they need to make sure of if they're conducting those trainings?
Yeah, and I would again say CPR obviously is mannequin based, so it shouldn't involve, that close personal contact. But I think with people that potentially are doing life-saving trainings where if there's some kind of rescue activity that they need to demonstrate, I'm not sure again what the activity is that requires unmasked interpersonal contact, but if that can be justified, they definitely need to have clear screening of folks to make sure there's no illness for people that are going to participate in those trainings. Definitely good monitoring and listing of whose activity in case someone does get ill, that there's quickly a ability to do that tracing for those close contacts.
Okay. One more swimming question for you, and that is, are team swim practices, not a high school team, allowed to be happening now? Coaches are not in the water with the swimmers.
Yeah, but I mean, they're swimming, just recreational swimming is allowed within the gyms, whether it's for, training or just people swimming laps. So all that is allowed. And it's based on just the occupancy and the amount of people that can be in a lane. So depending again on the facility. So all that is acceptable.
What about club teams? I know there was a lot of talk about if you're not a CHASA sport and you're not actually the high school practicing, can club teams now practice, club swim teams?
There is, there's different sport activity now that we are in yellow, and then there still are variances for club teams. So it's not a one answer. If you've already gotten the variance as a club team that applies to CHASA, you can follow those requirements. There are some, again, sport activities outdoor that allow up to 25 people. And again, in just general swimming, whether again it's a club team or not, it just applies to that sort of lap swimming of how many people can be in a lane. And the occupancy within indoors. So it really just, it's more focused on that. So if it's the competition component, that's where there still are some limits on how many people can be there. And again, it's dependent on whether you're indoor or outdoor, which I assume you're indoor right now.
I would hope so. That would be kind of cold. But those guidelines for that are under personal recreation on the covid19.colorado.gov site.
Correct.
All right. So let's get into some other topics. Do you have any insight or anticipation of the impacts of the COVID variant on our metrics? Are you concerned about these variants and in rising numbers into the spring?
We are concerned that, the projections are that the new variants will become the dominant strains, and that will be the majority of the disease we see. As of right now, most of the variants, we believe the vaccines will have high efficacy. And so that's very good. But there is the potential for further mutations. So that's the ongoing concern, is where will things continue to move? So it's very important that when people are able to get vaccine, they get it, because that's really the only way that we end this pandemic. So, the public health dial and people wearing masks and social distancing is just minimizing spread of disease, but the vaccine is what can help end it. So that's where we really need to get this done, so that we stop the ability of this virus from mutating, because we kind of end its ability to circulate within our community.
So that was a nice transition into our next set of questions around vaccination. We have a percentage of the seniors. You showed the percentage of seniors that have been vaccinated. Is there a percentage of the seniors that have signed up within the community in the county? Is there a big lag time or a big wait list right now?
No, I think well, I mean, I guess, yes, we have people that haven't gotten it yet. The lag is the amount of vaccine we're getting. So it's not that people haven't signed up. That's why our percentages are low. It's just it's the percentage, it's the amount of vaccine we're receiving. So again, we are now over 70. The number I showed you was as of Sunday, and we've already had some clinics that have bumped us over. So we're going to keep moving through that. We do know that there are some hesitancy in the community. So some people have refused vaccine. So that's another reason why we aren't a little bit higher than we could be. But overall, having good success, also in long-term care facilities where a lot of the 70 plus population, certainly the 80 plus population lives. So we've gotten a lot of our high-risk folks vaccinated, and we'll keep moving through that. But unfortunately, some people do refuse vaccine. So.
And this leads to kind of a clarity question in here. And I want to say, so right now it's healthcare workers, people that are 70 and older, teachers, and 65 to 69. Then in that next part of 1B, which doesn't even start till March, according to the state, they're not even opening those potentially until the beginning, sometime in March. Then you talk a little bit about that frontline manufacturing and some of those other key groups. And this question is actually from a manufacturer that asks, is Boulder mandating critical infrastructure manufacturing companies to direct their employees to get vaccinated? And so I started with the first part, which is the timeline. We're not even into that second part of 1B, but can you answer the question about mandating critical infrastructure to be vaccinated?
I mean, we want everyone to be vaccinated. So as far as will we have a law mandating them to do it in order to operate? No, but it's critically important for our community and for those businesses to get people vaccinated. So as your phase comes up, there is not a mandate that everybody must be vaccinated. As I've said, people have refused in some of the categories that have already happened, but that jeopardizes our community. When people don't get vaccinated, we don't reach enough level to truly make sure that this virus does go away. So it does, and we know that while it's an amazing vaccine, 95% effective, 5% maybe not effective. So that means some people that get vaccinated still could be at risk, even though it's a small percentage. So every person that doesn't get vaccinated just adds to that further risk within the community. So it's really important that they do.
And we've talked about this in previous weeks. So just because you're a manufacturer doesn't mean that all of your employees are frontline manufacturing workers. Some of them could be office if they're working from home. So there's levels within organizations that will fit within the different phases. So when we get to that part of 1B, it's the frontline manufacturing, those people that are coming in contact potentially with COVID-19 positive people, but that doesn't mean the entire manufacturing facility qualifies for the vaccine. Is that correct?
Yeah, and it'll likely be something that the businesses need to evaluate the different roles that people play to figure out who fits in those. We have not gotten wonderful guidance from the state, and we may not get it. So that might be an effort that we will be undertaking to help provide that clarity that everyone's been seeking on who exactly is going to fall into these categories and who is not. The one other group that I want to mention that's in the current listing is also the it's very similar to schools, but it's childcare. So those licensed childcare are also on the list where we're actively vaccinating those folks.
And there have been changes to the different levels. So even though, group 2 changed, and so there are things that could change as time goes on, and that's all state led. And you really have very little control over those priority levels at Boulder County, right?
We try to influence, we share a lot of feedback with the state, but ultimately the governor is making those final calls.
Okay. Another vaccine question. So we have a kind of a performance facility or a theater facility that got a request from a retirement community to do a performance, to have an event. And because everybody's vaccinated, do they still need to have all performers and attendees be 25 feet from each other? I know you said that might change to 12, but is the vaccination, making sure everybody is vaccinated, does that change any of the rules or the orders at this time?
No, it does not. So, so again, we believe that the change they talked about for sports and audit, the attendees being 12 feet away, that will be translated into any performers, not just sports. But it will not change that people can be unmasked and have, that'll go away completely. So that's the only reduction we've heard on that separation distance.
And partly this is in protection of the staff that's at the facility as well, because while those individuals may be vaccinated, there's no proof yet that they can't still, they're not going to get as sick, but they may still be carrying the virus or could transmit the virus.
Yeah, we don't know. I mean, there hasn't been any reported hospitalizations or deaths from people that are vaccinated, but there have been some people who were vaccinated that did get the illness. So, so it's again not 100%, and some people could be carriers without having symptoms, and then potentially infect other folks. The workers should also be vaccinated. They were in that priority group for those people that are working at long-term care facilities. But overall, they really should think that through carefully, because that's still a high-risk population. And so bringing in performers that are unvaccinated still adds a risk to that community. So
they were actually going to go to the facility, and actually the seniors were going to be some of the performers, but you still have the wait staff and some of those others who are not part of the retirement community, who may not be vaccinated, who may be at risk as well.
Yeah, it doesn't, vaccine, as much as people maybe have hoped for, it doesn't create a free-for-all where you can sort of do anything and are untethered. It dramatically is going to impact the disease in our community, but it doesn't mean for those that are unvaccinated, you are zero risk to them. So so that's again the concern. So people still need to be cautious on their activities once they are fully vaccinated. Still wear your masks, still socially distance, wash your hands. Those are all still very important. And they're also important for all the other respiratory diseases we're dealing with, because there's a fair number of respiratory diseases in the community. It's not just COVID. So it helps minimize the spread of all of them.
And they clarified that it's a private event, at a facility, but being vaccinated currently does not change any of the order requirements, I think, is ultimately the piece of this. Okay. We have a question as to, do you anticipate us going from level yellow to green anytime? I just want to point out the next level is blue. Yeah. Green is that protect our neighbors phase. Do you anticipate us going to blue anytime soon?
We're continuing to trend. We still have a big jump in cases to get all the way down to meeting the blue metric. But we're trending there. So yeah, that is the hope. And again, the more vaccine that gets in the community, we should continue to see those numbers drop. And then again, as long as our healthcare system is still favorable on that end, we potentially could get to blue. But as far as a date on when that'll happen, I don't have a projection on that.
So even in blue and green, so even if at the higher dial levels, do the space between tables at a restaurant, for example, change to anything less than 6 feet, or is that still a requirement within those levels as well?
It doesn't change. What potentially could change is the dial itself changing. So again, if the governor makes edits to the dial in his next iteration, that may change in there, but it's really capacity based for that. For green, there is more flexibility within the community now, so that is a possibility. But again, we are a really long way from green. We're really not seeing hardly any disease in our community at all to be in green. So so again, that's the hope, but we're definitely a ways off from that.
So in blue, for example, for restaurants, so we're in yellow right now. So anybody joining us right now, I don't want you to think we're in blue. We're in yellow right now, but in blue, the restaurant capacity got increased with the latest order. So it's still 50% or 225, whichever is less. So it really benefits the larger facilities, those larger restaurants, but the 50% is still in there. And they're still requiring the 6 feet distancing between tables, the masking when not eating and drinking, all of those pieces.
Yeah. So that larger capacity is really based on the space to accommodate, people up to that. So you would need a fairly large space to have that many spaced out tables.
So under yellow, the last call for on-premise consumption of alcohol is 11 p.m.
Correct.
Under FiveStar, when we are able to allow FiveStar certified businesses to operate in blue, the question is, does that liquor service time change? And the answer is they would now be able to operate in blue, and that last call time is 12 a.m. for on-premise if you're operating in blue. That's one of the reasons I'm giving each of the municipalities a list of all businesses that are applying as well as certified, so that they're aware of the businesses that will, once we hit that 70% of the 70 plus in the state who are vaccinated, who will be able to operate in the blue level, which does include a later last call. At this time, unless the order changes, that's currently the understanding that you will be able to operate under the blue levels. Okay. So if you anticipate that if you're a FiveStar certified business and they move to that new 12-foot distance, would it protect you on the dial if they ever move back to the 25-foot, or do you see that changing?
Unless there's a huge surge in the state, I don't see the dial and its metrics getting more stringent. I see it relaxing. So again, I don't think the dial will change again until hopefully at least the governor sees that the trends are continuing to be favorable and our percentages of vaccine continue to get higher and higher within all the communities. Then likely the dial will be relaxed again. So I don't expect things to get more stringent. I think over time they will get relaxed.
But the point of the FiveStar program is to operate one dial level above. So if it were to hit that point where we were in red and that was a change that was made back in the red, those businesses ideally would still be able to operate at orange, which just gives you that a little bit of flexibility because you have been inspected, you are following public health protocols, and it's a benefit of the variance.
Yeah. That being said, if you have a space that you can still accommodate more space, that doesn't hurt you. So it doesn't mean everybody needs to reconfigure their entire space to do all these changes, especially if it isn't really going to provide you a ton more seating. But if now you can sneak in a couple extra tables, that's great. But it may not be the end all solution for all the businesses to have that number change dramatically. So
we have a dinner theater on the call, and some of their performers double as wait staff prior to the performance. Is that allowed for them to be wait staff and then become performers under the guidance? And is there anything they need to be aware of?
Yeah, I think just that being conscious of social distancing, wearing masks when they certainly are not performing, hand washing, making sure it's clear who's potential close contacts, within the setting, but there's nothing that prevents people from having multiple kind of jobs.
But when they're wait staff, they need to follow the restaurant guidance. When they're performers, they can follow the performer guidance as far as that goes. So we have on here someone that brings youth into their facility, and they've had some complaints because they're their mask policy is doesn't include 2-year-olds. They're in Lafayette, which, so they're not under the Louisville order, but they've had some complaints that they're not requiring 2-year-olds. Is there any guidance on the best age for masks? Is it dangerous for 2-year-olds to wear masks? As some, a lot of the sites are a little vague on this particular issue.
Yeah, I mean, it's encouraged because I know it varies. I have heard a number of people who have very young children and they wear masks and effectively do it and are at their preschools and childcare centers where they're doing it. But it is not a requirement of the order. So it's not something that would lead to enforcement for that, because that's not what the order requires. It's just encouraged. So we don't see, we've seen some spikes. It hasn't happened in the last few weeks, but about 3 weeks ago, there was a pretty significant spike from that 0 to 9-year-old age range, which is a bit broad range. Doesn't mean it's all the 0 to 2-year-olds, but there was a significant spike in that age range. So it's not something that those kids cannot get sick and certainly couldn't transmit it to others, but it's not a requirement of the orders.
Well, and in some cases, there are places that say, 2-year-olds shouldn't wear masks. And I think there's just some confusion about those companies that do service the 2-year-olds as to whether or not they shouldn't. And then when they get complaints about it, it becomes a little bit of a what do I follow kind of feeling.
Yeah, again, it's more of an encouragement for those parents, especially when they're that young. They're going to be closely supervised, but it is not a requirement of the public health orders.
Do you know of any local municipalities that say they should not be worn by 2-year-olds? We can look into that.
No, I don't. I don't think anyone has an order like that.
Okay. Do we need to continue disinfection practices on non-public areas given the low risk of transmission on surfaces?
Yeah, I don't know that there has ever been a requirement for that. So again, it would be high touch surfaces. So I'm not sure what the specific reference they're putting out there, but there is no new requirement to expand to non-high touch surfaces for frequent disinfection and cleaning, outside of, depending on what sector, if it's already required for you to do as part of a requirement. So again, if it's within food service, food contact surfaces do need to be washed, rinsed, and sanitized. And so, but versus food storage areas do not. So,
and in some places, if it's an office and it's a non-public place, it's not a high touch area, they have their cleaning crew come in on a regular basis and do that.
Yeah. So
but
again, you're not wash, rinsing, and sanitize all floors, walls, and ceilings of spaces. Those are not considered high risk areas.
But if it's a shared desk or the kitchen or a conference room table, between use, if you're using it, they still encourage you to, because that's a high touch area. That's people are coming in, and when they say public, sometimes they mean employees as well, coming into a space and sharing a space or sharing surfaces. Okay. So apparently the New York Times uses data from Colorado, and as of February 17th, the New York Times listed Boulder County as red, a very high risk level based on per capita and test positivity. Do you have any thoughts on that, or is that something that people should worry about, or is it's just because the data is not aligned with how Colorado is kind of tracking the data too?
Yeah, I can't speak to that article, so I have no idea what data they're referencing. I have great confidence in Emily, who handles our data, and how current and active they are at digging into it. So I know our positivity percentages are very good. So again, not knowing what they're alluding to, what they're digging into, maybe they've got some subset of data. I have no idea, so I can't speak to that. But what I've presented is very accurate. So our overall positivity percentages are very, very low. And again, per the Colorado metrics, in that blue dial phase.
And that positivity rate's low, not because people are testing less. We still have a lot of tests going on. We have a lot of testing facilities. Actually, there's more testing facilities, free testing sites all over the area than we've had throughout all of this. So testing is still high. It's just our percent positivity has gone down.
Yeah, and that again, that's a good trend. So again, I don't know what they were referencing, but it's always important to dig into the sources of data that they're using.
I have great confidence in Emily too. I've been on many meetings with her, and she's definitely a data geek. She gets it all, and she has it all pretty well under control. Any other questions out there? You can ask. We can answer 5-star questions. We can answer questions about the order. Appreciate everybody joining us today. I'm doing last call for questions because I usually get 1 or 2 when I do that. All right. Well, it looks like last call. All right. Looks like that we have no more questions coming in. Again, these are at 1 o'clock on Thursdays, but if you have any questions in between, I know that many of you will reach out. Specific questions that may not be able to answer on here. Please reach out one of those email addresses, either the covidbiz@bouldercounty.org, or if you can just press reply on one of my emails, you can do that as well. I did send out the Spanish recording for this week already in this week's email. So the Spanish recording of the same slides have also been released as well. And then I'll get you the link to this week's recording. In the meantime, we hope everybody has a wonderful weekend. Stay warm out there. Hopefully it's not in the negatives again this weekend, so we can get outside and enjoy our Colorado.
That's right.
Thanks, Lane.
Thank you, Corinne. Thank you all for joining.